Naman is a long distance runner who has recently started participating in half marathon races. He occasionally develops stiffness around his knee and also says that he has an old ankle injury. As a coach, therapist, or a trainer, you try to check and compare the range of motion at the ankle, knee, and the hip joint. You find a difference in the range of motion of both ankles. If the difference in range of motion is due to mobility or flexibility, how do you further proceed? Looking for answer to these queries, you're in the right place. Welcome to this NPTEL offered course on physical medicine and rehabilitation in sports. We are in week 6 focusing on flexibility and mobility related training. And today's lecture is on techniques for improving joint mobility. You are with me, Wing Commander Chandrasekhar Guru. I'm an associate professor in sports medicine from Department of Sports Medicine, Armed Forces Medical College. The learning objectives of today's lecture will be to focus on importance of joint mobility, the factors that influence joint mobility, what are the various ways of assessing joint mobility and techniques to further improve or address the joint mobility issues. We'll also discuss about the practical aspects using a case scenario. Why joint mobility important? Joint mobility helps in kind of maintaining the functional performance of the individual, prevents injury and enhances biomechanics. It is also vital for rehabilitation and return to play protocols. Let's understand joint mobility. We know that joint mobility is an active range of motion available at the joint. It is influenced by the joint capsule, the muscle surrounding the joint, and the neuromuscular control. It is differentiated from flexibility by means of the uh, active nature that is involved in joint mobility. So, we saw that joint mobility is an active range of motion which contributes to the active range of motion, whereas flexibility is more of a passive component which is dependent on the connective tissue and the muscle length. So, mobility is a broader perspective in which flexibility is a subset. Factors that affect mobility are both anatomical and physiological factors, joint shape and structure, capsule and the ligament compliance around the joint, the muscle bulk as well as the tone, which helps in creating the range of motion around the joint, and the neuroactive activation and the control, which controls all these structures. Any pathological issue in terms of inflammation or scar tissue or adhesion can also affect the mobility of the particular joint. How do you assess joint mobility? We can assess clinically using joint specific range of motion testing by simple use of a tool called goniometer, where it gives the angle in an objective manner. You can use inclinometers, functional movement screening method, where you use different movement patterns to assess the mobility aspect of an individual holistically. It can be either an active mobility or a passive mobility. So, you initially do a passive mobility to see the range and then thereafter ask the individual to do the active. So, that gives the active component as well, the neuromuscular complete uh, loop as well is examined in an active mobility. It is also important to compare both the sides to see any difference in the symmetrical values also. How do you classify the deficit? So, once you do an assessment, you get to know if there is any deficit at all, and you can also identify or assess the deficit based on either side to side, comparing the bilaterality, or you can also have a baseline value from which you can see the longitudinal effect of the training, or you can also have a normative data of a specific group of athletes at that level, and then you can compare with that standard. So, that also gives the deficit or the requirement to reach a particular level in a particular sport. So, if you want to classify this deficit, it can be based on the cause, it can be because of soft tissue restriction, it can be because of joint capsule tightness, it can be motor control limitation where the muscle and the neuromuscular system is involved, or maybe pathological because of pain or inflammation which is ongoing near the joint. So, these factors can affect the mobility and cause deficit, and accordingly you can classify them as well. So, when you go for a mobility based training, it is important to establish a goal, so that helps in kind of achieving the goal in a structured manner. So the rehabilitation and performance goals in terms of mobility training are, grossly, the immediate goal would be to restore the optimal range. In case of rehabilitation, it would be a pain free range, gradually progressing to the maximum full range of motion. Whereas in case of sports training, it will be kind of to reach an optimal range as per the joint angle that is required in particular joint of to execute the action in that sport. Second important aspect is to have, since mobility is about active control, it is important to have the appropriate motor control. So especially in sports rehabilitation, post injury, there is a deficit in terms of the motor control. So proprioception and neuromuscular coordination are also affected. So these have to be addressed in case of rehabilitation, sports rehabilitation. Whereas when you're looking at performance, it is important to have a specific type of motor control, so that it gives you the optimal performance for that particular sports. The third important aspect or goal is to also have optimum tissue quality, improve the tissue quality in terms of, say for example, in injury case, sports rehabilitation, if it is a ligament related injury or an healing that is happening, then the quality of the tissue has to come back to the pre-injury level, so that that kind of assistance will be there in helping to have a appropriate mobility. So it is important to align that particular goal with the phase of the rehabilitation as well. Whereas in performance, it is to improve the tissue quality in terms of increasing the muscle length, or it may be in terms of increasing the joint range of motion. So thus it can also help in kind of improving the mobility training. The last important aspect is that to also have a goal to reduce the compensation pattern that can happen, because any kind of pathology or an anatomical deviation because of the sports training per se can cause compensation in the other kinetic chain. So that needs to be also addressed. So assessment and training helps in kind of identifying the deficit early and helps to prevent the biomechanical compensation that can happen because of the constant loading. So having known about the deficits and the goal to address this deficit, now the main crux of this particular lecture today is to discuss various techniques that are available to work on the joint mobility. So the various techniques are shown here. We will discuss each one of them as we go through the lecture. See, the soft tissue mobilization is basically aimed at kind of mobilizing the soft tissue, the tissue kind of adhesions that may be there, which may be a reason for or cause for reduced mobility. So manual techniques are generally utilized in terms of doing a myofascial release, either using your own digits or the therapist digits, or by using instruments. So this, when instruments are used, they are called as instrument assisted soft tissue mobilization. The tools commonly used are firm in nature. Commonly you can use a golf ball or a roller. You also have commercially designed instruments to practice soft tissue mobilization. Commonly these are used over trigger points release or for taut band release. So this helps in kind of achieving the better joint mobilization by means of mobilizing the tight soft tissue which is adherent onto the muscle. So that is how it can help in joint mobilization. Another commonly used technique for enhancing soft tissue mobilization is foam rolling. Whereas foam rolling is more of a self myofascial release, wherein the individual uses it post activity in as part of cool down routine as well. It causes increase in the blood flow and tissue hydration, and kind of considered to decrease the muscular tone. So muscular tone decreases and helps in kind of relaxing the muscle as well. And this can be used either pre-activity or post-exercise. Generally, it is advised to use post-exercise. Joint mobilization technique, again, in case of conditions involving the joint or the capsule of the joint, where the restriction or the joint mobility is restricted because of these aspects, then we go in for something called as joint mobilization technique. Joint mobilization technique can be manual, using various methods like chiropractic methods, maybe Maitland method or something, where you use sudden blows to kind of cause orthokinematic changes, and that helps in kind of mobilizing the joint. The other method commonly employed is also mobilization with movement, where you use movement, the therapist is you causing the movement passively with the help of some bands along the range of motion of the joint, which causes movement at the level of the joint orthokinematics. So that again helps in kind of mobilizing the joint, and improves the accessory motion and the capsular extensibility. See, more so it is important in sports rehabilitation with capsule additions during the injury process, or even in cases where you have systemic diseases which may make the individual prone for capsular additions, like say for commonly called as the frozen shoulder. So these techniques can be used there as well, and commonly employed during the initial phase only, so that reduces the additions around the joint and help in achieving a better or a full range, near to end or a full range of motion in phase 1 itself. Another important technique used to improve the joint mobility is dynamic mobility, where it is more of an active mobility drill, where you enhance the range actively. It is again by using controlled movement based drills. You can incorporate it in the pre warm up routine itself. Also, you can add on weights to that mobility drill to increase the or activating the muscles that can stabilize the movement, and integrates the neuromuscular control as well. There is certain type of active joint mobilization technique like controlled articular rotations. These are basically joint capsule stimulation techniques wherein you encourage movement at the end range, and it is to improve the joint awareness and stability. The purpose is basically to kind of create a functional range conditioning, so that the individual kind of improves the range of motion. It is generally done towards the end of the phase 1 of sports rehab, when the individual is able to increase the range of motion and reach a certain level of pain free range. This is done actively by the patient or the individual, and it helps in kind of in the pain free range, and gradually helps in kind of improving the range of motion as well. In an advanced stage, where in phase 2, end of phase 2 or phase 3, you can go for achieving full range of motion with the resistance training as well. See, it is basically a functional form of strength development using mobility technique, wherein you can use functional movements like squats or lunges or overhead press using added weights. So this helps to improve the resistance training or the activation of the muscle in force production during the uh, extended range of motion. So that is one way of improving the strength over a full range of motion, and it reduces the muscle guarding. Another way of improving joint mobility is by enhancing the proprioceptive training, because again proprioceptors are key in giving motor control and movement control, especially post injury. So incorporating balance and coordination drills helps in kind of better repositioning of the joint, and then help in kind of movement control, especially crucial after injury. More commonly you can say in terms of ankle injuries, where it has been seen in scientific literature as well, that incorporating proprioceptive training actually reduces the risk of re-injury in most of the lower limb related injuries. Stretching techniques also can be used to improve mobility, as we have been discussing about flexibility and the stretching techniques in this week lectures. Dynamic is preferred for warm-up activities and can be used in more of a movement related drills. Static stretching is used in post exercise cool down. and in combination can be used to kind of improve the joint specific mobility drills as well. We also discussed that there may be neural contribution in terms of reducing the joint mobility. So that can happen because of the adhesions around the nerve that pass through the fascia or the muscle. Say that can be done by doing certain procedures like nerve glides and flossing. It basically addresses a neural tension. Commonly seen are the sciatic and the median nerve glides, which can be done locally, or you can also involve the individual to do more of an active mobility or relaxing programs using the neurodynamic procedures, using the self-stretching techniques as well, say for sciatic nerve or for the median nerves. Important especially in radiculopathies as well, for chronic stiffness as well. The another important technique that is used prevalently as a mode of recovery as well, in kind of improving the joint mobility or mobility on as a whole, is vibration and percussive therapy, which also include certain perturbations training as well. So this is mainly used in recovery, and it is also used in pre-activation as well, to improve the performance or neuromuscular facilitation as well. So percussive gun is a commonly used modality wherein it's the vibration or the percussion that can be used to kind of address a region of specific stiffness or taut band that is how it is present. So these are kind of used as a recovery method in the cool down after the activity as well. Commonly you would have seen in separate recovery stalls kept in the mass running events as well. So this helps in kind of reducing the stiffness and enhance the blood flow and reduce the tone of the involved or overworked muscles. So let's discuss the case scenario. Naman is a long distance runner who has recently started participating in half marathon races. He occasionally develops stiffness around his knee and has an old ankle injury. So as a coach or a trainer or a therapist, you try to check and compare the range of motion at the ankle, knee and the hips, and you find a difference in the range of motion of both the ankles. So what is the difference? Is the difference in the range is due to mobility or flexibility, and how do you further proceed in this particular individual? So let's analyze this case. It's a long distance runner, also has gives history of an old ankle injury, right? So he says that there's some stiffness around the knee. So you check the range of motion and the mobility, and you found that there may be decrease or change in the dorsiflexion, ankle dorsiflexion, and there may be increased mobility in terms of the ankle joint with increased pronation. So ankle dorsiflexion, you can say it may be because of the calf tightness as well, because if the calf is tight in the posterior aspect, doesn't allow the ankle to completely dorsiflex, right? So there it is more of a flexibility related issue. So you will have to address that by giving stretching exercises of the mainly of the static hold, or if the difference in the ankle dorsiflexion is more, then you can go for even a PNF related stretching activity, so that the difference can be addressed at a faster rate. And that is if the is because of the calf tightness. Say if the ankle joint, since it's an old injury, you can also have excessive movement, or the because if the individual had not gone for proper rehabilitation and return to play protocol, the individual will have developed weak muscles around the ankle joint. So that would have led to an excessive motion, mainly in terms of pronation at the ankle joint as well. So it is important, we can it is easier to come to a conclusion with this, that there may be definitely the weakness of the muscles around the ankle joint. There may be if the injury was recurrent, the old injury was a recurrent issue, then there may be also problem with these structural joint as well, where there may be osteophytes or any kind of dislodging of the osteophytes and forming loose bodies around the ankle joint as well. So that needs to be ruled out. Further, the mobility related aspect can be also due to say the disruption in the proprioceptors which is around the ankle joint. So that again can affect the balance, muscle coordination also. So these are the aspects that can lead on to further mobility related issues in this particular individual. So accordingly, the cause has to be identified and has to be addressed. To summarize this particular lecture, mobility is essential for optimal function. It is the multifaceted approach. The technique involves both manual as well as the movement, so that the active kind of mobility is instituted or kind of regained over a period of time with proper designing of the mobility training program. Assessment is key. More than assessment, the deficit has to be individualized. Accordingly, the exercises have to be incorporated into the routine training program as well. Addressing the mobility issue holistically is again an important aspect, because it is not only restricted to a particular kind of cause. The as a whole it has to be addressed, because since it involves multiple components, not only the passive component but also the active component as well. These needs to be included in their training routine, so that it kind of helps in injury prevention, not only as a short term improvement but also as a long term re-injury prevention program. So that prevents biomechanical compensation pattern as well, which may also lead to injury of the other structures in the kinetic chain as well. So for those of you who are interested in further in-depth reading about the flexibility and mobility aspects, I would suggest these references. Thank you once again for joining in, ladies and gentlemen. Jai Hind.